Welcome to another episode of TooHealthTalk, where we share everything health insight and everything about healthcare here in Nigeria and in Africa. On today's episode, we have a medical student with us, the person of Grace Agan. Hi, Grace.
Hi, Raymond.
How are you doing?
I'm doing fine. How are you?
Fine, thank you. I'm so excited to have you here with us today.
Well, thank you for inviting me.
You're welcome. So let's dive into today's, talk. What's like studying medicine in Nigeria, and like what's your journey like?
Let me tell you something. Actually, I didn't expect medicine to be what it was. You know, when you're growing up as a child in Nigeria, they glamorize certain professions. Medicine, law, engineering, everyone loves them, family favorites. I wasn't necessarily pushed into medicine, but I grew up with medicine around me in the sense that my dad was a very respected doctor.
Wow.
He was a professor, actually. So I idolized the profession, and I was like, and the thing with me is I've never been a reading person. However, I had that innate talent. So I cruised through secondary school, I cruised through 100 level, 200 level, 300 level. And then I came. No, the thing is, they'd always tell you while you're studying medicine, doctors, they tell you medicine is the cause of sacrifice. But I never really grasped the sacrifice part because I was actively cruising. And then I got to the point where all the load came and it became so cumbersome. Because another thing they tell you is outside the country in like the West, they could make things easier for them. It's not even they do make things easier for them. They have more opportunities. But here in Nigeria, you have to not only learn about the history of the things you're learning, about the history of the things, but you also have to learn about the future of the things. So we're constantly burdened with knowledge and like an insane amount of load to accumulate, and the time is just never there. So if you want to survive in medicine, you just have to sacrifice. And I feel like at this point of my academic career, I am learning to actively sacrifice. Sacrifice your mental health, sacrifice your social life, everything.
Oh, so do you see medicine as a calling?
I'd say yes, actually, because I've never really had affinity for any other thing. You know, I feel like as a child, I was just like, oh, medicine. And I cannot see myself doing anything else. You know how people are like, oh, if this doesn't work out, I'll look left, I'll look right. But no. And another thing I noted was that while I was like feeling down and dejected about medicine, I'd listen to encouragement from like senior colleagues, like doctors in the hospital. And it would just reawaken that passion in me, and I just don't see myself in any other position in life.
So is getting into the medical school harder than you think or harder than you expected?
The problem isn't getting into med school. The problem is staying in med school.
Is there maybe a colleague that, like your friends that maybe got into the school with you and they're no longer in med school now?
A lot, like 15, I guess.
50.
15. If I knew 50 people who left med school, wouldn't you be bothered?
Is there any subjects that in med school that gets on your toes, like, you know?
I'm speaking for all medical students in Nigeria, in the world at large, when I say pharmacology.
Wow.
Let's not even say for path and farm in itself. The whole 400 level course load is like pressing down on your neck.
Wow.
Yeah, that's just it. I'm very sure everyone will agree with me. Path and farm, but specifically pharmacology.
Wow. Is the learning environment conducive for you here in Nigeria?
Do you want? Actually, no, it is not. Most medical students would tell you that at least in. So I know of, let's say, 5 medical schools because I have a lot of friends who are studying medicine as well. So I know a bit of their schedule. So in most medical schools, you'd have lectures for like 9 to 10 hours a day, every day. And I'm not talking about like oh, you're having this, you're having that. No, it could be the same course, it could be the same lecturer. So in all universities, you probably have to go through that at least from 400 level up. You'd have to have marathon lectures throughout the day. So would I say it's conducive? No, but medicine in itself is a hard course, and that's just the type of thing you have to get used to. Because as a doctor, like you are constantly facing patients every day. Not let me not say every day, but like a majority of the year, you're going to be facing patients, and they're going to be coming with different scenarios. So you need to become accustomed to being inconvenienced at an early stage.
So you talk about having marathon lectures. How do you balance your social life and like studying medicine?
This is where sacrifice comes into play.
Well,
Me personally, I'm like I like being outside. Let me just say that I like being outside. So I feel like it is individual. Like different people handle it different ways. Most people studying medicine, here's the thing. The reason you don't see medical students talking a lot about their social lives being suppressed by the course they're studying is because a lot of people studying medicine make it their whole personality. They make it their own life, their whole life. But for other people like myself who we we have a life outside medicine, and medicine is my sole purpose of existence. I actually enjoy being outside. But you need to decide which you love more. Obviously, like if you are opportune, please by all means go out. But medicine is like a little rat race. So you're constantly going to have to do something, you're constantly going to have an exam. And if you slack off, you will lag behind and you will suffer. Let me just suffer. You see that suffer? Put it in caps. So I feel like if you feel you can cover back up, by all means go out. But in the reality of the sense, as a medical student, you have to forfeit a lot of your outings. You have to forfeit your relations. I'm not going to say you're going to cut off your relationships with people, but your unavailability will like pose a strain on your relationships with a lot of people. So you just have to like choose which one because you will have to give up something. It's a cost of sacrifice.
so are you saying medicine in Nigeria is suffering or what?
No, I'm not saying medicine in Nigeria is suffering. However, I am saying it will consume a large portion of your life. It will consume a large portion of your social life, your mental health. You will sacrifice things for the course that you are studying. Medicine is a course of sacrifice.
Okay.
So I'm not necessarily saying that it is suffering. It depends how you look at it because to some it's a labor of love.
So you talk about mental health. Have you ever like seek help on like your mental health?
Nobody has time for that today. The time that you are using, the time that you are using to seek help for your mental health, people are reading Minds.
Oh.
Yeah.
So how do you view like since you venture into medicine, how do you view the healthcare system in general in Nigeria?
Honestly, it's not conducive for growth. I recently saw an article that there are only 30,000 practicing doctors in Nigeria. Nigeria has like 240 million people. That in comparison to the amount of doctors is insane. But when you consider the patient to doctor ratio, the pay, the facilities which we have, the investment which government puts towards maintaining the health of the population, you'd understand why a lot of doctors wouldn't find it conducive. You can't give up your youth and your finances and your social life. You can't give all these things up for subpar I'm going to say reimbursement. Yeah. Medicine in Nigeria is a labor of love too, because you have to really love saving lives to stay in Nigeria to practice medicine.
So I can stay.
Please don't ask me questions Don't ask me questions that may implicate me in the future.
Oh,
We will find out.
wow.
You will find out.
If you're going to stay or not.
Yes, come 2020. Ask me again in like 2027, 2028. Come
Wow.
and find out.
So, what's the misconception about medical students? Like you know about? Is there anyone you know about? I give you some popular ones. Too.
Okay, let me think about this. I once heard that medical students are very lazy physically. Yeah, this was in the gym. I was in the gym working out, and the trainer was like, "Oh, what do you do?" And I was like, "I'm medical student." Like, "You people that are lazy." And I was like, "Have you ever stood in the same spot during a surgery for 5 hours while they drill you and ask you questions to which you don't know the answer? Have you stood in the clinic while the consultants consult for 3 hours, while they ask you questions you don't know the answer?" See, the thing with medicine is, especially in clinical levels, you go to lectures, you have lectures for a span of hours. You go to the hospital, you stay in the hospital for another span of hours, and you probably be standing on your feet throughout. Then you go and you have lectures again till like evening. And then we have these things called logbooks.
Yeah.
So obviously the time that you spend in the hospital during the day is not enough to like fill your logbooks to the grades that you want.
Wow.
So after having the lectures for hours, like you spend the whole day, maybe like let's say 11 hours of the day in like in the normal curricular setting, like what is supposed to be on your timetable.
Yeah.
You would still have to go to the hospital in the night.
Whoa.
Yeah, let's say you have a patient that you've cleared and you're supposed to be following up. You go back to check on that patient. You want to learn some procedures like setting a cannula, setting up a line. You will go back in the night to learn. So you're gonna say you're getting up 6 a.m. You maybe look through a previous lecture at 6 a.m., 6 a.m. You get ready 7 a.m. You leave your house 7 a.m. You have like the things on your timetable, the actual curriculum from 8 a.m. to let's say 5 p.m. You're going to go home at 5 p.m. and then you're going to go to the hospital by 6 p.m. You just go home, you have a change of clothes, go to the hospital by 6 p.m. and you will probably leave by 12. And as you're leaving by that 12, let's say a doctor is seeing you, it's like, why are you leaving by 12? You don't want to do all-nighter.
Wow.
Yeah, so the misconception is that medical students are weak. And when they tell me that thing, I'm going to say, go and like do my day, do 1 day. Let me say 1 day, do 3 days. Live the life of medical students for 3 days and come back and talk to me again. And what's another misconception? That like all we do is read. Please.
But the one is true now. All you guys do is read. Even like the doctors I know now that special, they still read. You see them.
We read, but that's not all we do. Yeah.
Oh.
Like me personally, I'm not going to speak for everybody. There are people who all they do is read, but like people who don't really center their whole lives around medicine. Let me say people. I have course mates, and a lot of my course mates, they have lives outside medicine. So some of them do YouTube, some do podcasts, some do art, some do commissions. So medicine, maybe it's just my generation.
Yeah.
But I feel like from the medical students that I have experienced, that stereotype doesn't really apply.
Have you ever faced any challenges studying medicine in Nigeria, either lack of equipment or strike?
Okay, so I go to a private university, so strike has never been an issue of mine. But in the case of lack of equipment, it's not a principal problem for me. But as a medical student, you have to do this posting for community health, where you go to like a primary health center to see the conditions in which a majority of Nigerians find themselves acquiring healthcare. And I like to say that the conditions are not favorable. A lot of them, they don't even have proper labor rooms. They don't have the basic equipment that have been developed in the past decade or two. Like the healthcare condition in Nigeria is quite bad. I personally, I wouldn't say the name of the health center that I visited, but it was very, the word I would use is dilapidated. It was very bad. And it had me thinking of the wealth that we have in the country in comparison to the quality of living that a lot of Nigerians are forced into. So, yeah.
Wow. So what keep you motivated studying medicine?
The commitment that I have put in already, when like I would think like, how many years have I been studying this course? Give up care so that my enemies will laugh at me. Biko.
So in your journey, like in studying medicine, have you like shaped your dream on any specialization? Do you have any specialization in mind, or you want to go into NGO?
For the longest period, I wanted to go into cardiothoracic surgery.
Wow.
And then I did this one posting where I had to shadow a neurosurgeon. And I don't know, like, my heart was just like, my heart was swaying a little bit, but I wouldn't like to give a definitive answer because a lot of students, a lot of doctors, they make the final choice in their housemanship, which is basically our internship.
Yeah.
So I guess come back 2028, you figure it out.
So what's the advice for someone studying medicine, like, or someone that wants to study medicine? Sorry.
Don't view medicine as a competitive course. A lot of medical students enter in from 100 level and they feel like they're fighting their course mates. University is not secondary school. Let me just tell you now, university is not secondary school. Nobody is giving you first position, especially in a course like medicine. I once witnessed a medical student stealing their classmates' assignments to sabotage their classmates. Like they just randomly picked from the pile. The person could have been their friend, they don't know. But they stole assignments to make sure like they didn't get submitted. And that image stuck with me. That was in 100 level. Medical students will try to one-up each other. And the thing with medicine is that it's such a cumbersome course that at a point in time, you will need, not even at a point in time, from the onset, I'd advise that you make friends because there are things that you didn't hear in class that they could teach you, they could motivate you to study, they could push you to be better. So don't view medicine as a competitive course. University is not secondary school. Do not isolate yourself because the hardest part, at least that from me and other medical students I have consulted, is 400 level. If you like be doing Luna in like medical school, you will need your course mates' help, and not just your course mates. After university, there is life after university. You need to consult a co-worker about a case. You need a second opinion. All these things are things that rely on your social interactions and your relationships with other people. So I'd advise that you maintain a relationship with your peers because it's very, very important, at least to me. And please, sorry, last bit of advice. If you are not ready to second guess, like just mellow down as you're entering because medical school will so humble you. Medical school will have you questioning your self-worth, your commitment, your effort. The effort you put in may not always equate in the results that you are getting. So come in not wholly expectant, but like come with the force, but don't come with the arrogance because medical school will humble you.
So, but if you're going to look back now to like the future, if you're going to rewind back to the future, will you go back to study medicine?
If I had the chance to rewrite the past, I would study medicine because, like I said, it's been like the one thing at the end of my tunnel vision. I've never seen myself doing anything else. So yeah, I would study medicine.
You've never seen yourself doing if medicine not work out today now, you did not see anything you're going to like push into.
Medicine not work out. My parents should better go and start looking for their son-in-law because that's been my only goal for the past 21 years.
Wow. Okay, no problem. So we've come to the end of the show. Once again, I want to thank Grace for coming on board, and thank every one of you for watching. So please, if you want to support us, or if you like what we're doing and you want to support us, please subscribe, like, and share this video. If you want to get to see more doctors, more students, medical students coming to share their stories and all, please like, share, and subscribe. Thank you very much. Once again, I would like to thank Grace for coming on board. Hope we get to see you next time when
Next
see a
time I'll be
doctor.
charging attending fees, please. Yeah, like then you'd have to like pay because at that point my word would be consultation. So
Oh, sure. Dr. Grace, right?
yeah, Dr. Grace.
Okay, now, bye, guys.